Hi everyone. So it's been longer than I'd actually intended to put out another video, but I wanted to give you an update on a couple of projects that I've done recently. So um, one thing that happened just about a month ago was what's called an FDA rare disease patient listening session. I talked about it a little bit in a previous video, but that was before it actually happened. So what that is to give patients who have a particular rare disease, in this case, limb girdle muscular dystrophy, a chance to talk to people at the FDA who are the ones who oversee drug development and clinical trials of new medical treatments in the US. Some information about the patient perspective on having this rare disease. So, the idea is that, to approve a drug, you have to demonstrate that it's safe and that it's effective at treating a particular medical condition. Okay, but safe and effective are kind of value judgments. So it depends what is safe enough and what is effective enough depends on who you're talking to. And the rationale behind these listening sessions, as well as other programs that the FDA has in place, is that the people who actually have whatever disease the treatment is intended to address should be able to weigh in on what they consider a meaningful treatment that's meaningfully effective to improve their quality of life, and what they would consider safe enough, as well as to just talk about what it's like for the person living with a given disease, what their experience, how it affects their life, and also if there are current treatments, how well do they work, what issues do they have, what isn't able to be treated. Now, for LGMD, it turns out there aren't any current treatments for any genetic subtype of LGMD. So that's actually a very easy thing to answer. So in the listening session, we had a total of 15 people, all of whom were patients with different genetic subtypes of LGMD. It turns out that out of approximately 30 known subtypes, 12 were represented between the 15 patients. And everyone did just an amazingly good job of recounting their experiences living with the disease. One of the things that tends to happen in talking about having a rare disease, and this happens in sort of social media patient groups, a lot of times people will want to sort of show their best face to the world and talk about what they're able to accomplish in their life, or fun things that they've been able to do in spite of having the medical condition. But in talking to the FDA, it's really important to explain what a burden having this disease is, and to show them that life isn't all great. There are a lot of difficult moments, showing all the problems that this causes, and why it's really important that a treatment can be moved forward as fast as possible. And, I have to say, all the people that I worked with on this presentation, just did an amazing job of, showing all the difficult aspects in their lives, and, were just very candid, and, it presented things in what I thought was a really touching way. And, so I, want to say a huge thank you to all of them for that. Now, it turns out the rare disease patient listening sessions only last for an hour, and out of that, an hour and a half. And out of that hour and a half, the FDA requests that you leave 15 minutes on the end for questions, and 5 minutes on, at the beginning for the FDA to give some disclaimer statements. So, we had to do everything in an hour and 10 minutes, and because LGMD has many different genetic forms, which have some differences in the age of onset and, the symptoms, how much breathing is affected, if the heart is affected. We had to really paint with a broad brush and couldn't get into a lot of detail. It turns out the FDA does have additional programs, one of which is called a patient-focused drug development session, or PFDD, and we may be doing one or more of those on different particular subtypes of LGMD. It's a little bit of a challenging call to, figure out, do we want to lump several genetic types together into a common PFDD, or have a PFDD on, each of the most common subtypes. That still hasn't been decided. Where the people that I'm collaborating with are talking about that. So the other thing is that a PFDD is essentially considered a private meeting. So there's not really a recording of it. People outside, the presenters and the FDA people and a few select invitees were the only ones who were invited to the call. There is a written summary, and I can send you a link to that. Unfortunately, in spite of the fact that, it was, amazing, and, I'm so happy and so relieved about how well it came out, I really can't show it to you, because, it's sort of, very personal and very private information about all of the people, but, I will send you the link, and, it really was well received. Unfortunately, we didn't hear a lot of feedback from the scientific and medical people at the FDA, but the people in what's called the patient affairs staff were sort of very complimentary, and a lot of people who attended complimented us in actually being able to get through all of the landscape of LGMDs in an hour and 10 minutes. So that's I'm extremely happy and extremely relieved that that went well. And of course there's a lot more to do, but I think we've given the FDA a little bit of a view from the patient perspective on what it's like to live with LGMD. So with that, I will sign off, and I will be back in touch later.